I'd like to call the meeting to order of the Senate Health and Human Services Committee. It is Wednesday, March 26th, 2025, and we do have a quorum present. We have a very full agenda today, and we are going to make a change due to the availability of testifiers for Senator Putnam's bill, and we will move that to the beginning. So Senator Putnam and your testifiers could join us at the table. So Senate File 328. And members, you have a handout that was just put on your packet just now. So Senator Putnam, welcome to the committee. And please begin with your presentation.
Thank you very much, Madam Chair and members. Thank you, Madam Chair, for hearing the bill, but also for accommodating our curious morning. We very much appreciate it. So what Senate File 328 does is it supports a collaboration in my community. A couple years ago, some folks realized the challenges that we had providing preschool for the kids in our district. And we had a tremendous, massive wait list. And so on their own, the Rotary Club, of which I'm a member, decided to do some philanthropic work to raise enough money to partner with the school district to increase the number of seats we were available to offer in preschool. Now, members, I think there's a high likelihood that many of you are thinking, well, that's great for St. Cloud, but what about my district? Well, that's why we're here. This is a pilot program that we're trying to sort of encourage the kind of collaboration that's happening in St. Cloud and encourage you in your own districts to talk to your Rotary clubs, your Kiwanis clubs, whatever sort of philanthropic groups that you have at your disposal to do similar work. But first, in order to do that work as well as we can to facilitate that collaboration, we need your support now. And so, Madam Chair, I'd like to turn it over to our testifiers who know a lot more about it than I do.
Great. Welcome to the committee. And if the first testifier, if you could state your name for the record and begin your testimony.
Yeah, thank you, Madam Chair and committee. My name is Amy Trombley. I am a Rotarian in St. Cloud. I'm also a proud graduate of the St. Cloud Area School District. I attended preschool there, actually, all the way through high school. And now I'm currently a Vice President for Community at Initiative Foundation. And I believe you have a packet of information in front of you, which I'll be speaking. Really just impassioned. How I got involved with Rotary was actually through this project. I used to work at United Way of Central Minnesota, where we really focused on supporting kids cradle to career and to the table to talk about collaboration and collective impact for our young people. What the Rotarians found out through book club is a variety of things, and what they wanted to do was impact kids in our community and our future workforce, our future community development. And they knew by investing early and investing in our kids how essential and important that return on investment is. Right now, according to data, about 35,000 Minnesotan kids don't have the expected skills to be ready for kindergarten. And what I'll say is our kindergartners, our 5-year-olds, they're ready to go. They may not have some of those specific skills that are kind of expected or supported in their development to be as successful as possible. And that's really what we're aiming to do and support in central Minnesota and through this collaborative partnership. The Rotary has been able to secure and match a partnership of dollars to support more kids having access to preschool in our community. And the data shows that for every dollar invested into early childhood programming, you get a $16 return on investment. Now, I'm not sure, I'm not a betting, well, no, I am a betting person, but I also know about investing early and return on investment, and a $16 return on each dollar is a pretty great bet to put forward, and we know that investing in our kids makes a real difference. And the data consistently shows that. We know this logically where to invest, and sometimes it's hard to take that investment and invest it in the long game, but that's what we need to do, and our Rotarians truly believe in that and tried to expand this program statewide within our district area. We also were able to work with a lot of different funders to make this project happen, from CentraCare, local donors and individuals, Initiative Foundation, the Morning Optimists, Parker Foundation, Stearns Electric, Coburn's, for example. It's a whole community that's wrapping themselves around this project to make this happen. And on the next slide, we talk about our Rotary, through our community philanthropic efforts, have invested over $289,000 into this project to make sure that our 3- and 4-year-olds have access to preschool, because there's a huge waiting list. And I'll turn it over to Dr. Putnam to talk about the program and the impacts that it's had.
Thank
Great.
you.
Welcome to the committee, and please, Dr. Putnam, please state your name for the record and begin your testimony.
Thank you, Madam Chair, members. My name is Lori Putnam. I'm the superintendent in St. Cloud Area Schools, and I'm grateful for your time this morning. The program started back in 21-22 when our then superintendent, now Commissioner Willie Jett, partnered with Rotary, and they asked, what's your biggest need, right? How can we best support? And we all know that investing in our littles is our best bet, as Amy said. And so we began that program in 21-22 with just 25 students. We co-located with the Boys and Girls Club, again, to speak to the deep level of partnership that happens in St. Cloud. It was a success. But we wanted to be able to expand. We were ready to do that. And so in 22-23, we started to push out into the schools, but then we realized that transportation continues to be a problem. Again, a barrier for some of our students to access that early learning. The district stepped in to provide transportation, and this year we moved to 4s. We were doing 3s and 4s, and now we moved to 4s, because despite this incredible partnership that's happening, we still have over 120 students, 4-year-olds alone, on our waiting list. 120 little ones who are wanting education who can't get it. And then that doesn't include 3s. So we decided this year to focus on 4s. We're proud to have expanded in just this short time to serving 96 students this year. 96 more students will be ready for kindergarten. And so we're very grateful for this opportunity to speak, and I'll turn it back to Amy to share about the data that we're seeing.
Ms. Trombley?
Yeah, and excited to share the data with you as well. So it starts on about slide 9, if you have the packet in front of you. And just a little bit about my background in history. I actually taught in the St. Cloud Area School District, 5th and 6th graders, and then was a district assessment coordinator. So pretty steeped in the data as well. And we can talk about really the important pieces of this program of young kids having access to learning how to line up and how to share with a friend, and all of those maybe soft skills or transferable skills that are so essential that young people learn. And being able to have those experiences as a 4-year-old is essential to their brain development within their first 5 years, with 80 to 90% of their brain developing happening during that time. But we also have the numbers in front of you to be able to show that this is having an impact on their academic data as well. And so if you look at the demographic data, what we know is that less than 50% statewide of our 3rd graders are being proficient on the MCA, showing that they're effective readers. And we know that in St. Cloud, looking at some of our gaps within a delivery gap, really focusing some of our students living in low socioeconomic conditions, students on free and reduced lunch, for example, if you want to use that terminology, it's really important that we're really focused on supporting those kids very intentionally. And then when we look at the retention rates and go on to that next slide, what we're finding is that about 80% of the kids that participated in our preschool success program since 2021 are still within our district. And so that's a great return on investment as well, because once those kids and families are part of our district, they're staying in our district. And St. Cloud has a great opportunity when it comes to a variety of options for preschool. And we know that being in our public school system can be really essential to their overall development. Looking at the next data, just to not glean over things, but to just let you see the numbers in action, what we've found is that district-wide, we're looking at early reading. And so district-wide, about 42% of the kids are on target to meet their literacy skills. And what being on target means as a kindergartner or first grader, it means they're on target to pass or be proficient on the 3rd grade MCAs. And so 42% district-wide, and kids who participated in the preschool success program, 49.6, so almost 50% of those kids were proficient, showing that they're ready. And if we look at the sum risk, that also shows a lot of promise. And we see that also matriculate into math, about 10 percentage points more for those kids who participated in preschool for success than the district-wide data. So we know that kids that are participating in this program over the long term are also seeing those academic gains and successes when we're investing in them early. The next two slides, their letter names and letter sounds, really talk about very specific skills, and we see even higher returns on investment. So not only are kids getting that holistic value in data and opportunities for their literacy skills, but when we have them in our schools and are able to teach them letter names and letter sounds, they get it. And this data shows that they're getting it. So when we have them in schools, we have them early, they're able to access preschool, we know that they're being successful into the future. And so our plans continue to grow and really are hopeful that this partnership can be a model of a public-private partnership that other communities can replicate to support our littlest learners as they continue to grow, which we know then invests in our communities, workforce development, and our future in being vibrant communities and having thriving economies. The last quote says, "It's easier to build strong children than to repair broken men." And we really believe that at the Rotary in St. Cloud and hope that you help support us in that as well.
Thank you very much for your testimony. Members, do you have any questions? Senator Cran.
Thank you, Madam Chair. Senator Putnam. So we just described it. It looks like good results. I think everybody, I don't know anybody would argue with that. So what funded the program for the last 3 years?
Senator Putnam.
Madam Chair, Senator Cran, it was a partnership between the school district and the Rotary Club. And I think, I don't know the exact numbers, but it was close to 50-50 with the Rotary Club's philanthropy. And the model that we've adopted is to maintain that collaboration. This is not merely, this is not to replace the philanthropy of the local community. It's to supplement it, complement it, and allow the program to expand. One of the things that inspired this initially was awareness that we had over 200 kids waiting for seats in preschool in St. Cloud. And I was part of the reading group that Ms. Trombley was mentioning, the book club. And when we heard that, we thought, well, that's just unacceptable. And so we began a capital campaign raising resources from the spaces that Ms. Trombley designated. And the goal is to continue that relationship and expand it through this additional support.
Madam Chair.
Senator Cran.
Thank you, Senator Putnam. So the dollars were allocated out of what pool from the school district prior to, or for the last few years?
Senator Putnam.
Madam Chair, Senator Cran, I'm going to have to phone my friend who's sitting next to me.
Dr. Putnam, do you have where the money came from?
I do, thank you, Madam Chair, Senator Cran. We take it out of our general fund.
Madam Chair.
Senator Cran.
And so are you experiencing financial difficulties today while you can't continue that funding within your own current funding stream?
Dr. Putnam. Go ahead.
Okay, thank you. We are able to continue the funding that is our commitment for the next year, but it of course pulls resources from other places, and so the hope is to be able to continue and possibly even expand, knowing that we still have, again, over 124-year-olds, and that doesn't include the 3-year-olds.
Senator
Thank you, Madam Chair. So with the financial challenges you had, or you have, and I think every single school district is experiencing it, and so we want to fund those good things. This would be a priority, and so I know you have great pull. I don't understand why you haven't been able to convince Senator Putnam to ease up on the mandates that would currently free up some dollars. These are small dollars, and I think I think it's good, but to pick a single school district out, I'm glad with the results, but you've been able to do that now on your own up until this point. Great to partner with Rotary, right? The Civic, our people care, and all those things are good, but it's extraordinary. This peanuts. You should be able to scrape that out of your budget. We do understand the financial stress you're under, and I would hope you would really put some pressure on Senator Putnam to ease up on those mandates and free up those pools of money that aren't currently available to you. So, Madam Chair, I think it's a good program. I just got to twist you a little bit. Thank you.
Senator Putnam.
Madam Chair, if I may respond, Senator Cran, thank you for your comments. I just want to note that Superintendent Dr. Lori Putnam is in fact Superintendent of the Year in the state of Minnesota, partially because she balances the books. St. Cloud is one of the very few school districts of its size that is in actually pretty strong financial shape, and that's due to Lori, Superintendent Putnam, who's sitting next to me.
Thank you. Other members, do you have any comments or questions? Well, I really appreciate your bringing the bill forward and bringing your testifiers today. It sounds like an impressive program and one that I can see you've really thought through, how well it's serving the district and how many kids could be helped if you're able to continue and expand. And it would be, we know that being able to serve 3-year-olds is certainly pays off as well. So I am a big supporter of trying to expand our supports for kids so that all those years can be covered. But thank you for bringing the bill forward, and Senate File 328 is laid over for possible inclusion.
Thank you, Madam Chair, members.
Thank you.
Thank you. Next, we will go back to the beginning of the agenda, and we have an update on child care regulation modernization from DHS. And Larry Hauschild is here to present. And what I was hoping we could do today, members, in the past, we've had some updates on projects that are related to licensing, modernization. And maybe all of us haven't been here for those, but today, since we have kind of limited time for presentations now, we have so many bills that that people would like us to hear. So I've kind of asked DHS and Mr. Hauschild to really focus the presentation today on the current status of the licensing standards modernization aspect of the work they're doing, kind of where are we at, and then what is the plan for the rest of the year, getting to a final draft and legislation. And then his presentation also includes examples of how the draft 2 standards, which came out in February, I believe, how they have changed from the original draft. And so I think there are quite a few examples that you've given, and if you can highlight, maybe not go through all of those examples. I think members can read, and if they have questions about specific ones, we can go back to them. But I would appreciate if you can keep the presentation part fairly brief so that we can get to member questions about the project. So, Mr. Hauschild, please go ahead and state your name for the record and begin.
Great. Thank you, Madam Chair, committee members. My name is Larry Hauschild. I'm the manager of the Policy and Legislative Team for the Office of Inspector General. Great to be here today, and great to be bumped this morning by the St. Cloud School District. I have 3 children that go to the district, and having Mrs. Trombley and Dr. Putnam bump us is something I'm willing to do any day. But wanted to talk a little bit about the Child Care Regulation Modernization Project. This is a project that was created by the Legislature in 2021. I'm just going to go to the graphic right here. Part of the project affects both family child care and child care centers. And there's 3 primary components to that project. One is creating a risk-based tiered violation system. Second, a key indicator system to allow for abbreviated inspections. And the third component, revised licensing standards, which I'll really focus on today. But I want to make sure the committee understood the project as all 3 of those components. I'm going to talk mostly about Draft 2 today, but I want to talk a little bit about what brought us to Draft 2 and the process that we used for the initial draft that was brought forward for a public comment. The initial draft of revised licensing standards was released in the spring of 2024. During the summer of 2024, extensive stakeholder engagement was made. Over 23 in-person listening sessions occurred throughout the state. Most of those listening sessions included two parts, afternoon part for child care centers and evening sessions for family child care. During those sessions, we had over 950 participants and over 2,500 individual comments that were taken in that helped inform the second draft. In addition to that, we conducted a survey in which we had over 1,600 unique responses to that survey. And we also had focus groups over some that really touched upon some specific kind of hot button issues, in particular behavior guidance, training requirements, activities equipment, environmental health, physical space requirements, and cleaning and sanitizing. So through all that input, we worked over the fall to create a second draft of the standards that was really informed by that stakeholder outreach and engagement. And then the second draft was released in February. I want to stress this is a draft. It is not a proposal, just as the first draft was not a proposal. It was to solicit feedback, to get input, and to continue the iterative process of trying to develop a revised set of standards that both protect health and safety of providers, but also ensure fairness and a regulatory structure that works for providers as well. With that second draft, we also released a revision document, which looks much like a legislative bill with new language underlined, old language stricken, and then kind of a summary of significant changes that accompanied the second draft. Just going to talk a little bit about some of the things that changed between draft one and draft two. I'm trying to condense down what our summary document from the first set of revised standards was 46 pages long. So I'm trying to condense down those 46 pages into about a 5-minute presentation. So I'm going to go really quick, but hope I can answer questions afterwards. These changes that I'm going to talk about first affect both family child care and child care centers. The first major change is simplifying cleaning requirements. You'll see in a lot of the work that I'm going to discuss here is we use the word removing, reducing, simplifying, and clarifying. And that's what the work we really did between draft one and draft two to try to simplify, clarify, and reduce some mandates and requirements. And cleaning and sanitizing is one of those. So we took some of the specificity out about what products had to be used, the frequency of the use of those products, and we really worked on just reorganizing the content for clarity and reducing that specificity. For example, originally we said that a provider would have to clean their freezer on a quarterly basis. I don't know about you, but I don't know the last time I cleaned my freezer and sanitized it, yet alone on a quarterly basis. So we reduced those type of requirements between the first draft and the second draft. Some other additional changes for both programs involve scents. The original draft, we prohibited the use of scents, aerosol sprays, essential oils, those type of things. We heard from providers throughout the state that providers work in an environment with dirty diapers and not the greatest smelling odors at times, and they use scents and aerosols to help mask that. Understanding that there are chemical sensitivities for children, we remove that prohibition and really kind of lean towards the provider accommodating a child that might have chemical sensitivities on a case-by-case basis instead of having a blanket prohibition. Another area in which we received a lot of spirited feedback, and in a lot of ways with the first draft, it was never the intent of the department to have an absurd result. One of the areas in which there was an interpretation was on pets and being free of feces and odors and pet hair and those type of things. A lot of people were very concerned that the language of being free of pet hair would prohibit pets and prohibit family animals, and that was never the intent of the department. So we clarified that area of statute so there wouldn't be misinterpretation. Same thing with pests. The original draft had a requirement for providers that when they exterminated a pest, that they would have to document that. And it was really meant for more invasive type of pests, but there's an interpretation that if I have to kill a fly or if I have to kill a mosquito, do I have to document that? And that was never the intent of the department. So we made clarifying language and reduced those concerns. Some additional changes for both providers. There was an original requirement to test for lead in exposed soils, and knowing the impact of exposure to lead to young children. But especially on the family child care front, we heard throughout the state that the practicality of testing for lead on exposed soils was one, very difficult to implement, and two, overly intrusive. So especially for a provider that might be on a large lot and they play on an acre or 2 acres of land. Where do you test? How often do you test? How much would that cost? And it was very difficult. We learned quickly that the implementation of that, as well intended, was not practical. So we removed the lead testing requirements between draft 1 and draft 2. The water supply testing also, we reduced that requirement. So if a provider has a municipal water source, already does testing, a requirement to test for the water source for lead was something that would no longer be required. And it'd be, as we kind of practice it now, if you have a well, test for lead and significantly change current practice. There is still a requirement for radon testing. We did create some simplifications and some leeway in implementation time for implementing radon testing. As we know, radon in Minnesota is the largest contributor to lung cancer for children outside of exposure to tobacco smoke. So radon, we've worked with the Department of Health to try to work on a radon testing requirement that works for providers. There's still outstanding questions on the impacts of cost. What if there is a positive test for radon and there's mitigation needs? How are those costs absorbed? And those are discussions that we continue to have, and we anticipate will continue all the way through next legislative session. Some changes for documentation and simplification. I'll just try to go over this real fast, mostly focused on behavior guidance, children with special health care needs, and then different health policies and safety requirements to reduce that paperwork and that administrative documentation. A few changes for family child care. We introduced a new license class. This would allow for a capacity of 10 children with 2 adults, and where no more than 6 children are infants and toddlers. We also created a new license class, the C3 license class. This would allow for up to 18 children with 2 adults. This is up from 14 currently. And then also to be able to qualify for these new classes, the B3 and the C3, there have to be 4 additional training hours obtained to be able to be eligible for these classes. And that's what this last slide is, but I will try to keep going quickly. Physical space requirements for family child care. Originally in draft 1, we had a requirement for a continuous fence or natural barrier around the play area. Again, the practicality of that, we heard loud and clear from providers. So now we altered that to allow programs with a fenced outdoor space to create and implement a supervision or safety plan if they can't have a fenced space. We also had a clarification in indoor temperature and humidity, and we went back to essentially existing practice versus the previous draft where there was some humidity control requirements. And then lastly, for family child care, fall zones. The original draft had a requirement for fall zones such as, pea rock or, some type of fall zone material. And depending on the height of that fall zone, it ranged between 6 inches and 9 inches of that fall zone material. We heard loud and clear of the costs and the impacts and just the impracticality of being able to implement that on through family child care homes. So we removed that in response to those concerns. I'm just going to keep going really quick here. So I'm happy to go back to any questions, and we would also be happy to, outside of the committee hearing, meet with anybody that wants to go more in depth and detail with the changes. A few changes for child care centers. We kind of changed the nomenclature for aides and experienced aides, which is our current how we identify workers in child care centers, and change that nomenclature to an aide 1 and an aide 2. We also reduced the requirement to track how aide 2s or experienced aides are used, and reduced the experience hours from 4,160 to 2,080 hours. We also expanded the definition of education. I'm not going to go into the details about that expanded definition of education, but we had one definition where before we had two different definitions for education, and that 50% had to be in child development areas, and we expanded it to the one definition and hopefully opening up more post-secondary education opportunities to count as experience. We also, in the second draft, has a child care basics training. This is a training that the department would develop. We see this as being a tool for child care centers when they're onboarding and orienting new employees, that they can take a child care basic training, and so child care centers might not have to create a training on their own individual effort, and the department can provide that training. That training is still undefined. We would plan to work with providers about what they would like in that training, but we would make that available for all child care center providers. And then the orientation and basics training would also count towards their in-service training hours. Outdoor activity changes for increasing, instead of being 3+ hours a day, having to be outside, that it could be offered for children with, I think, 6+ hours per day. And we also aligned our outdoor temp requirements with MDH outdoor guidance. Just so, I think this is, for me, an interesting point, but that outdoor guidance is 90 degrees with a heat index included, and -15 with the wind chill included. And I'd like to see how many other states have that -15, but we're hardy Minnesotans, and our kids can go outside and play, I guess, with that -15. Also, furnishings, equipment, and materials. This is an area in which, overall, we do some of the specificity on equipment and materials that had to be provided. And this is something as a department we kind of struggle with, is how specific do we want to be and how flexible do we want to be? Specificity has no gray area. So if we say, you have to have 5 sets of building blocks for toddlers, it's very specific, versus you have to have a sufficient quantity of building blocks for children. Sufficient quantity can be open to interpretation, can be a gray area, and the application of that interpretation is inconsistent at times. So we struggle as a department over how specific versus how flexible do we want to be in our language. But in the equipment area, we moved away from that specificity and moved more towards flexible outdoor, equipment and materials and furnishings that had to be provided. Next steps. We just released the second draft in February, so it's just about a month old. People are still absorbing the new information, but since the release of the first draft, we've had 4 info sessions. Half of those information sessions were during the day, and the other half were during the evening hours. We had 429 attendees during those information sessions, and as you can see here, you can see the satisfaction rate of those who participated. Coming up, the next 5 months, 4 to 5 months, is going to be intensive stakeholder engagement on the second draft. We will be having at least 6 licensure focus groups throughout March and April. We are also working with provider association meetings. We've had 37 associations reach out to us to engage on providing feedback, and we're scheduling those association meetings right now. We are also looking at doing another survey. And we will also be partnering with the Minnesota Initiative Foundations again to do some statewide regional engagement listening sessions throughout the state. All the in-person sessions will include both afternoon and evening hours, because we know that oftentimes child care centers are most available during afternoon hours. And then our family child care providers usually are most available in the evening hours. So we try to balance that. As always, the email for our project team is included in the slideshow here. Feel free to reach out to them at any time. This is just a little graphic about the process of what we anticipate to occur. After we receive feedback on draft 2, we will start work on draft 3, and we hope to have a draft available for the legislature's consideration in 2026. And again, as with any any draft legislation, it's all draft and still subject to change, and we will continue to receive feedback and be flexible in our regulatory approach throughout the entire process.
Great. Thank you very much for going through that so quickly, and apologize for having to keep it condensed, but I think that you really hit on the high points. Members, do you have questions or comments about the presentation or questions about the project? Senator Liskey.
Thank you, Madam Chair. Madam Chair, Mr. Hauschild, I guess I got some questions for you. My district reached out to me pretty drastically after the first draft. It was pretty severe. Not a single thing did they expect to be able to do. It was pretty drastic. It was pretty scary for them. The first response I got was, I'm going to quit. I have 2 small children. I have children in childcare. Well, they just graduated. They're going to be starting preschool here in the fall. But my issue is, I guess my first question is, why did all of these harsh ideas come about? I guess, has there been a reason for this?
Mr. Hauschild.
Thank you, Madam Chair. Senator Liskey, thank you very much for the question. And I agree. It was difficult to hear those stories and the reaction from providers about the impacts and their concerns that they had. And we really did our best to try to make ourselves available to listen to those concerns. The basis for draft 1 was really taken out of the legislation in 2021 that required us to, and I'm just reading from that legislation, to develop a proposal for revised licensing standards grounded in national regulatory best practices. And then in addition to that, these standards must protect the health and safety for children and be child-centered, family-friendly, and fair to providers. So the first draft was really rooted in that grounded in national regulatory best practices. But as we know, best practices in the real world might not be the practical practices. So we started with that best practice document, wanted to get feedback, learn from providers, what makes sense, what doesn't make sense, what is impractical. And through the process over the summer, we then transitioned from moving from the regulatory best practice to what is fair, child-centered, family-friendly, and fair to providers. And I'm hoping that draft 2 is seen as a reasonable transition into something that works for them, and we will continue to listen to providers of saying, where did we miss the mark in draft 2? Where do we need to do more work on? Where do we need to add clarification where there's ambiguity? And that is a continuous process, and I hope that our work will show to providers that their concerns are being listened to. And I'll tell you, I attended a lot of those listening sessions, and not only could you hear the concerns, but you could feel the concerns from providers. And I hope our work, and as we continue to move in the process, will have something that at the end will be able to be embraced by all stakeholders.
Senator Liskey.
Thank you, Madam Chair. Madam Chair, Mr. Hauschild, I guess I'm going to start down the next line of questioning. How many members on your group have provided in-home childcare?
Mr. Hauschild.
Thank you, Madam Chair. Senator Liskey. Our family child care licensing team, I believe they're all former family child care providers. Yes, I'm getting a nod that they're all former family child care providers.
Senator Liskey.
Thank you, Madam Chair. Mr. Hauschild, I guess my next question is, so I saw in your slides there towards the end that you have a positive rating on the second draft. It's hard not to give a positive rating on the second draft when the first draft was so invasive to childcare and so demanding. Of course you're going to have a positive result because they're going to tell you, hey, you're being a little nicer, so of course I'm going to give you a positive answer. Do you think they're going to be able to give you an honest answer of, no, this one doesn't work either?
Mr. Hauschild.
Thank you, Madam Chair and Senator Liskey. I want to be clear that those ratings aren't a rating on the second draft, nor do we interpret it as a rating on the second draft. It was the informational sessions helpful to you? We're always trying to learn that, is our approach Is it helpful? Are people finding it valuable? So that's what that rating was on those informational sessions, not necessarily on your satisfaction with the second draft.
Senator Liskey?
Thank you, Madam Chair. I think I'm going to let some of my colleagues ask questions as well, because I'm sure we don't have a lot of time, so.
Thank you. Yeah, well, I would like to move to the next bill that I'm going to present around 9:30 because I have a testifier that has a hard stop. So, Senator Cran.
Thank you, Madam Chair, and Mr. Hash. You can understand the lack of trust, or the level of distrust from everybody, certainly in-home family daycares. Honestly, my wife opened one, so it was great to go through that process, or maybe not so great. Great to learn about it, but what I don't hear you talk about is how are we going to move forward from the perspective of growing and meeting the need. I think we're 5,000 in-home daycare short of meeting the current need. And what you've talked about today was incremental, very incremental changes to lessen the regulatory burden on certainly in-home daycares. But all of that feedback was provided on all of your listening sessions from day one, for which the agency ignored. And I think that, again, when we get to Senator Wiklund's bill, I think it's much better discussion and more practical. You guys are just creating work for yourselves, and with the fallacy that you've held listening sessions, that's what you get paid for, right? Go out there. But it was totally missing the mark. What is it practical for the health and safety of a child, especially in-home daycares? We have in-home daycares where they want kind of the farming experience. Rural Minnesota, they go out and feed the ducks, feed the geese, right? Feed chickens and working in the barns. What safety measures, none of what you've addressed here, covers the varied experiences for which our children live in and are seeking. Literally all they want is, I want somebody, if I can't be mom, I want somebody as close to mom or close to grandma as I can get, that's in proximity to my neighborhood, who shares my values, who I've inspected because I've walked through their house, I see how they live. That's it. Health and safety, all the things that we need to do are important, but you're missing the mark. And I don't hear anything from what you guys have talked about besides continuing on the path of maybe we'll lessen the pain a little bit. At the end of the day, there hasn't been, I asked the director, I attended one of the sessions, I forget what her name was, and I asked her, I said, tell me the top risks you're trying to solve for. She couldn't come up with one. She was the director, leading it. She had 3 of her staff there. It was I think we were in Sherburne County at that time. Couldn't give a single scenario to where we have current harm occurring in daycare facilities today. And none of what you talked about addressing any of those things, right? You didn't have it. And I'd give you credit, all of them did have some experience in daycare. So you got to go back to drawing board, and I think Senator Wiklund, we can agree at the end of the day, 7 of us could get in the room and create a set of policies that not only stop the loss or the moving to more underground in a completely unregulated environment, because that's what you're doing, and then to try and meet the need, how are we going to solve for the shortage of 5,000 in-home daycares today? We have to create incentives. How do we do that? Stupid fingerprinting of a 13-year-old that lives in the house. What? And you change the policy. You made all those things unattractive to every single person who would even consider entering into an in-home. In my Chisago County, one of them, we have, I think, a need for 1,000 extra slots. But yet at the same time, we have 100 open slots in daycare centers. They don't want daycare centers. They're forced into it by necessity, and the costs are far greater. They want in-home daycares for the majority of them. And they don't want you describing what a curriculum should be, how many building blocks. I saw one of your criteria that said, well, you could keep arts and safety supplies in an inaccessible location. What are you talking about? Have you ever run one of these to understand what the needs are that you should even have to consider talking about? Each one of these people who run a small business will store their stuff and to provide harmony and normalcy and access and, and to manage their facility. way off base. And so with that, you got to come to the drawing board. I hope Senator Wiklund, your bill passes and we put you back on the drawing board. Let's get 7 people who know what they're doing and come up with this set of parameters that provide safety for health and safety of the child well-being in the facilities where they are. And that's, I want in the next dialogue we hear from you guys, how are you going to grow? What are the initiatives to grow daycares? Because right now you're just trying to stop losses. And so way off base, we'd like to see something far different from you every time you come back before this committee again. Thank you.
Mr. Hash, do you want to add any more, or should I?
Madam Chair, I'm happy to follow up with Senator Grant afterwards.
Okay, thank you. Senator Abler.
Well, thank you. Welcome back. I appreciated working with you when we were in the House together, and I saw you as a thoughtful, reasonable human being. And I just, it's a dangerous department to work in, because you go in there kind of sensible and you come out with people that are worried about students, young people touching an electric fence. I don't live in greater Minnesota, but I have to think that anybody who's going to go to a daycare where there is an electric fence would have been already found out that it's not good to touch an electric fence. And so I don't think you need to make a rule about that. I mean, we don't want kids touching electric fences. And we can actually, I think if you're going to have a rule, you should say, well, if they do touch it, they have to let go after a certain amount of time to make sure that they don't suffer more than just a shock, that they don't actually come to. And so I remember when Doc Mulder from Western Brown County, was even somewhere out there, tried to get wading pools in child care, in licensed homes. And I'm not sure if he ever succeeded, because it gets hot. And then there were sanitation requirements. These are like the little ones that are like, 8 inches deep, and you fill them with water. When they get green, you're like, oh, I guess I better change the water. And no one had ever died from a wading pool, and he struggled, and I'm not convinced he ever got to it. And so I'm going to ask a question, then I'm just going to, so how many licensed homes do we have left? Do you know, Mr. Hash?
Mr. Hash.
Thank you, Madam Chair. Senator Abler, off the top of my head, and don't hold me to it, but I believe roughly around 5,800.
Senator Abler.
Okay. Yeah, I think I thought it was 15,000, we're down to 7,500, but I don't know what the numbers are. But anyway, so whatever number that is, and actually you might want to just pay attention, because 247 people from those licensed homes came to one of your things. If it's 1,500, it's 1/6. If it's 7,500, it's a couple of percent. And I can tell you why they don't go. They're exhausted. And they have 10 kids for one person. I cannot imagine that as a job. I have some patients who do that, and they come in like at the very end of the day, and they're like just so happy to get some care. But they don't have time to go even to fill a survey out, because they get through with their day. The kids come at 6:30 or 7, they go home at 6-ish, and then they have to like run their own family and maybe go for a walk or go to the park with their own kids. And so a lot of them are just thinking about quitting. And there's been research on rats, and when they pressed a bar, they would get a prize, get to eat something. And then they started doing it, if they got a shock, they pressed the bar, the shock would stop. And then they did an experiment where they would press the bar and the shock never stopped. You know what they did, Representative, Mr. Hash? They laid down and they gave up, just got shocked. They just like, there's no hope for me, so they quit. And I think that as you go back to the drawing board, and I suggest you reject draft 2 entirely on both fronts, and just go back and think, like Senator Cran said it pretty eloquently, so I won't repeat that, but like, what harm has happened? Has a child died? And tragically that they do. We talk about cribs and safety and, back to whatever, and all that. And guard against real risk. And don't make it, and so how do you draw people back in? over the years, it's at least 50% have left licensed homes. And many more are about to quit if they can find another way to make any money or take care of their own kids. Some of them actually just enjoy doing it. And they get paid to do what they love. And so if 247 people were happy that it was a nice presentation, then kudos to you. You put on a nice presentation. You presented well. You're extremely eloquent, very intelligent, and the department is well-intended. So how do you take that well-intendedness with people that just want to be able to serve and a desperate need in our state for licensed slots, or for slots? And also back to the child care centers. I just want to offer one comment about that. Do you think the parents that drop off their child at a center, if there was inadequate supplies or unsafe conditions that were not tidy, if the freezers were deemed to be like unsanitary, that they would bring their kid there? We had a restaurant. You know the last time we sanitized our freezers? I'll say never, because they don't get unsanitary. If you spill junk in there, then clean them out. We did, if you have broken packages of French fries and all that, but could you please make it so that it entices people to come? There's not enough human beings to work in child care centers. There's not enough people who, in my mind, are saintly enough to want to do licensed homes. So let's draw them in. Let's let the daughters of these and sons of these places take that on and make that your focus. And let the people who were doing licensed child care on your team actually remember what it was like. So I've gone long enough, but thank you.
Thanks. Any other members? Okay, I don't have any other members on the list. I appreciate your time today and that you can get a sense of what our committee members think about how things should move forward, and hopefully that's something you can discuss with your team as well, and provide feedback to the members that have had expressed their thoughts. So, but I appreciate your time, and if we have more questions, we will definitely let you know. So, thank you.
Thank you, Madam Chair. Appreciate the opportunity, committee members.
And members, we'll move to my bill, Senate File 1232, which is more of a narrowly focused on the licensing standard project, and some modifications that I think are warranted. And then after that, Senate File 2135, I think you'll find is another way to look at some of the issues and concerns that Senator Coran and Senator Abler have raised, and hopefully will get us started in kind of what can we do moving forward. So first I will move to the table and present Senate File 1232.
Madam Chair, when you're ready.
Thank you, Madam Chair. Senate File 1232 actually came about, started working on it last summer with my testifier and with other family child care providers. We met a few times in the summer, and that was when a lot of the discussion was happening about Draft 1. And it represents bringing forward some modifications that we think will be helpful to improve the process that is currently underway. I think that some of the general concerns about, more, how do we focus more on health and safety, that type of thing, will be discussed with the next bill. But these are some tactical things that I took away from our conversations and wanted to bring forward. I do have 3 amendments. One of them I'd like to treat as an author's amendment, and that is the A4 amendment. So I'd like to move that, and then I'll go through the bill.
Wiklund moves the A4 author's amendment. All those in favor signify by saying aye.
Aye.
All those opposed? The A4 is adopted.
Thank you. And so the bill, a lot of page 1 is really just updating some of the terminology, switching over to using the Department of Children, Youth, and Families. It also gets at some of what Mr. Hasch referred to, in that we wanted to state in Clause B that the updated family child care licensing standards, that the goal of the standards is to protect the health and safety of children and family child care programs and be child-centered, family-friendly, and fair to providers. I think the work done with NARA, the National Association of Regulatory Administration, it contributed to the work, but I think we would like to see them move away from utilizing that organization. And in Clause C, you'll see that we had taken out the words grounded in national regulatory best practices. That was referenced by Mr. Hasch. That seemed to kind of delay our ability to get to a more reasonable, rational approach about combining practicality with realism in creating any model for either standards or the risk-based model. On page 2, the significant aspects there on line 2.9, 2.8 and 2.9, just to make sure that as the department moves forward through the process of assessing draft 2 and coming up with the final draft, that they are engaging with working groups of licensed family child care providers. We put in a minimum number of times. I think from Mr. Hasch's presentation, they've got a lot of engagement sessions planned. We want to make sure that there is a minimal level of engagement work done, and that we are talking with significant groups, and that everybody has a chance to contribute. The amendment added language to include both daytime and evening engagement opportunities as needed, just to reinforce that family child care providers are really, that it is necessary to have the evening opportunities, and we want to make sure that that's always considered. Then if you move down to line 2.17, when I drafted the bill, we just updated the year from 2024 to 2026 from language from 2021. When the statute was created in 2021, it had February 1st, 2024. That date wasn't met for a final draft, of course. But when I updated the bill language, or updated the statute language, we just changed the year. I think that I would propose, and what the amendment does, is that we really need to pull that date back into 2025 to have them complete the legislative report and the draft. I don't think something delivered in February is not going to be enough time for legislators to engage with it, to engage with providers and understand whether it is meeting our needs or not. So what I've put into the bill through the amendment is a December 1st of 2025 due date for that report and proposed legislation. On 2.20, the amendment adds language that came about because of work that Ms. Cunningham did and other family child care providers to engage providers who don't speak English as their first language. And we felt that that part of the work that the department was doing was missing in some of the initial engagement process. And so the amendment adds a requirement that they must engage providers whose primary language is not English, to have them review translated materials so that they are able to provide significant feedback on any draft standards, and then how that should come about through focus groups and meetings that are at convenient times. And then the last change on the amendment is just to, we had languages that we want the materials to be available in, and Karen is really the more appropriate language than Korean, so we're switching that. The last paragraph in the bill, subdivision, or paragraph H, it gets at making sure that we have allowed enough time for implementation planning before new standards are implemented. And then also to have more discussion about the implementation of the risk-based model. That currently is proposed to be implemented before the new standards are adopted, and they are working on using the current rules in developing that risk-based model. I have a concern, and Ms. Cunningham as well, that that if we go through the process to adopt this risk-based model with the existing standards, then it is going to have to be redone when we get new standards developed. So I would like to propose that we restructure it so that we are doing the work to develop the standards that are needed. And then if we're going to apply a risk-based model, which I think is valid and important, that we're not having to do work with the new standards. So that is the bill. Members, if you have any questions about the bill, and then I have a couple amendments that Ms. Cunningham will speak to more directly. And I don't know, did you want to make comments in general too? Or just on this one? Yeah.
Yeah, on the main one.
Okay. And maybe I'll let the testifier speak first and then.
Greetings, Madam Chair and committee members. It's good to be here. I appreciate all the comments that have been made and the support over the years for family child care. I am a family child care provider 2 miles up the road in St. Paul for 27 years. I worked in the area of public policy for about 14, and I am currently the public policy chair for the State Association Leading Care. I'm very grateful for the work that I've been able to do with Senator Wiklund. She was on the Family Child Care Task Force, as was I, where this work originated. I am the one with the hard thing because I get to go home and play in the driveway with my children, so I will have to leave. We are testifying in support of this. As Senator Wiklund stated, we brought this forward and started talking about it because we were able to do through petition and hard asks of DHS to delay this. We knew when we got the first draft in hand within a week, we were in discussion with DHS, and I was horrified. There was no way we were going to be able to do anything, so the focus became a lot on our part just to get the delay, which is a primary purpose of this bill. This effort did not proceed as intended. I was in the room when Nara spoke. I was in the room when the decisions was made. I was involved with the legislation moving forward. This wasn't it. Nara was supposed to be involved. The first draft, actually in discussion with DHS, was primarily NARA's wording, that grounded in best practice. It was not Minnesota. The second draft, as reported in the House, was the Minnesota. We should have started with this now second draft. Some of us feel like we had a bait and switch. Make it really bad, make it really horrible, lots of uprising, no pre-discussion. My understanding is there was some with centers. There was none with us before this first draft was released. So we really feel that that draft should never have been released. There should have been more, whether it's 7 people, Senator Cran, or whatever. We would have been glad to have that discussion. Everything that has been happening is in reaction and response to what they are choosing to put out, including in the second draft. We pushed hard in the first, through the whole process, to have ratios considered. It was the #1 on a survey. Ratios had to be considered. DHS statement to us was we can't do that because we can't figure out how to figure out health and safety. We pushed. It was a loud voice again. So they magically, in this second draft, came up with ratios. No input, no discussion, no anything added, put in and everything. That's the really big piece. That's engagement. We are pretty smart. We could easily go through this. This second draft, and it was stated in the House hearing, is predominantly, like I said, going back to Minnesota. Just look at this as if it's our current bills, and then with some modification and some additions. To go through and read all the strikeouts and the underlines is a waste. Just look at it for what it is, and it really is what we have currently. Regarding the engagement, we put 5 in because there's never been a public plan until today. Is the first time I've seen what the plan is for engagement. And it was kind of like, start with something. In the first draft, all of those engagements came about because of the loud cry, because of many legislators meeting with their groups. And the MIFs really stepped up and said, hey, we'll do this. We'll do the engagement. So I'm appreciative that the MIFs are again doing that. Without that, we would not have had voices. There was no intention on the first draft. So hence, when we put 5 in, it was kind of like Hail Mary. Let's see if we can get anything. There have been many statements made to me through this time period and this development about making that these drafts have to be accessible. That has led to conversations where we were asked, it's in revisor's language, looks like it's done. Why would we not believe it's not done? So let's put draft across it. Well, we can't do that because it's not accessible. Okay, we can't translate it. I worked hard on the first draft to try to get translations, and DHS said we can't do it because it's not accessible. I don't know how that works. That is not 2 statements I can put in my own mind. What I ended up doing is I do have some relationship with the Latino group. I put together a presentation, met with them, walked them through what the draft was, what they needed to do. I will tell you, I don't know any Spanish at all. We had great interpreters, providers that were there. It was an amazing experience to be able to empower them to do that. Not my job. And not effective. So having to prescript and ask for what DHS has refused to do is what part of this bill does. We're hopeful that the engagement will turn around. We are relying where this will go. Whatever happens with this, the ask for December 1st, when I heard again, February, we're gonna get this 2 weeks before we're gonna do something with it, was horrifying. So the ask for December is to buy the time for legislators, for providers, for groups, for the public, to try to wrangle around with it, figure out what the some alternative pieces are, what we can keep, and then the real work's going to be yours. And I trust that there will be good work done. So thank you again, Senator Wiklund, for bringing this forward.
Any other testifiers?
No.
Did you want to go to member questions, or did you want to talk about the other amendments?
I think if members have, Madam Chair, if members have questions in general about the bill or comments, then the 2 amendments are kind of different topics. Ms. Cunningham does need to leave at 10, so I don't want to squeeze out time to be able to talk about the 2 amendments. So. Okay. But we can, general questions would be helpful.
Members, questions, comments? Senator Abler.
Well, thank you, and to the author and the testifier and people that are supporting this bill and the Hauschild bill coming after it. And I just would like to encourage Commissioner Brown, and as we form a whole new department, there's a chance for a clean slate. There's a chance, the question is, if we bring all these topics together, can it work better? And I just am nervous that we're going to have the same siloing going on, the same people not looking at the aggregate influence of all these, the CYF, you know, the part together. And so I think to, not to single you out, you are the commissioner, at least you're a department with a permanent commissioner, so that's kind of good. And so I cheer for you to be successful, but I cheer for your leadership and this opportunity to make this bill, I mean, just the element of help us out here unnecessary, and the Hauschild bill unnecessary, where that's something you would craft in your own department. Take the ideas here, and you don't need a law, I think, to do hardly any of this stuff. If you do, we'll clarify it for you. But here we are just now chasing your department, and you have to just please don't circle the wagons, and please don't go like, oh, well, we need to huddle down and have more meetings internally. Have the meetings about how are we going to make it work? How are we going to make childcare more available, more safe? How are we going to deal with all the issues about readiness that we heard in the first bill? And just explode your success, please. That's my comment. Thank you, Madam Chair.
Senator Coran.
Thank you, Madam Chair. Senator Wiklund, I'm on board with this, and I think the one thing that forgot for the agency was not only were the providers united and did they miss the mark, but almost exclusively all of our county licensors who do the work said no, we can't do it, we won't do it. We couldn't do it. So I think it was great. And then all the EDA, the people who led EDA in every county also showed up and said, this is the greatest challenge we have for our employers in all of Minnesota. So it's not unique to rural Minnesota, but that was one of them. But if we're going to move, I think we will move forward with this bill. I think we can get great support, one deposit. But I think we should add, if we're going to hire a consultant to guide, Senator Abler, I think he's right. This is their job from the beginning. We're here because of their failure, of the failure to address the real needs. But maybe we should consider, I don't know the path that this is going to take, but adding 3 criteria, a deep dive in. Let's not stop the bleeding, because that's all we're talking about here in the loss of slots. But what are those things? An overt attempt to go out and finally look, what will it take to bring 4,000 new in-home daycare providers into Minnesota? I don't know, even if we get the mark for those that are in it, they'll feel more comfortable, but what is it that can bring them in? And so if we're going to do it, maybe just add that to the criteria, two or three overt actions that will draw or attract new in-home daycares. So thank you. That's all I had. Thank you.
Senator Ecke.
Thank you, Madam Chair. And question Senator Wiklund on, actually on the original bill, it's on page 2, line 10. And I don't know if this has been something that got moved into other sections or not. I didn't see it, but why are parents being carved out?
Madam Chair, I think you can, my testifier, I think, can speak to that one where we changed that. It has to do with the, I'm sorry, you said, yeah, line 2.10, right. This was for the abbreviated inspections component of the projects that's being undertaken by the agency. And the providers that I worked with had a specific reason that they felt that would be better without that language. And Ms. Cunningham can comment.
Ms. Cunningham.
Madam Chair, Senator Ecke. Yes, the original was including parents. We have removed it from the standpoint, if we're talking about an abbreviated license, we're talking about the efficiency between the rules and the regs and the efficiency of the licensor coming in and planning their time, planning their visit about how deep that visit should be. And the thought in this is that parents don't have a clue how any of that works and are not significant in the investment. Parents need to be involved with rules and regs, and that this does not preclude this.
Senator Ecke.
Thank you, Madam Chair. Honestly, I would hope that the parents are involved and that you would have them included because, yes, it's been a long time since I used childcare, over probably 30 years ago. But the parents are the most important piece. I looked at it as it was our obligation to know where we were dropping our kids off and who we were leaving them with. I don't care what the state thinks or what anybody else thinks. It was most important to the parents. I think that's still an important piece to this puzzle. So I would just hope that in the end, parents are brought back in because their opinion, even if they don't understand it all, hey, they're going to learn, and it's going to help if they do learn the system a little bit. But I would hope that parents once again will be part of it. So thank you.
If you want.
Thank you, Senator. And then we just brought to our attention that if you look in paragraph D, parents are included. So they weren't carved out completely just from that section because of what Ms. Cunningham explained. I see no other questions or comments. Did you want to move to the amendment? Oh, Senator Liskey.
Oh.
Thank you, Madam Chair. Senator Wiklund, thank you for bringing an approach to readdress this issue. Like I was expressing earlier, I had gotten reached out to quite a lot. There was a large number of people that I hadn't talked to in months, years, what have you, but they all had my contact information, and my phone basically exploded when draft 1 came out. I actually attended an event for a child care appreciation night that was organized by Smith down in New Prague, which is part of my district. I was invited to come and talk because I was one of the ones that was very loud and vocal once I found out this was happening. And the one thing that I noticed, and the one thing that Senator Kranz touched on quite frequently, is the reason why people don't attend these events is not because they don't want to say what's going on, it's because they're exhausted. At this event that I went to, I'd say maybe a third of the people that were invited showed up because they all took days off the next day. They had a day off, which meant that they had the ability to rest after having a good time that night. I actually hand-delivered quite a few of the bags, the goodie bags that they had, because they were people that I knew and that they deserved to have those goodie bags. And so something to add maybe to the discussion, as Senator Coran said, is what can we do to instill a want to get back into childcare? And I can tell you putting more regulations on them is not going to do that. And that's why that draft was so badly approached. And so I appreciate you, Senator Wiklund, for all the work you try to do in the child care realm. And I look forward to seeing what this bill is going to do. Thank you.
Senator Kupec.
Thank you. I'll be very brief so we stay on track. I will just make an appeal that if we do have more listening sessions, we have a few more up in the Northwest. Several people from my district drove, I think, to Brainerd to get to the listening session. So that's a couple of hour drive from Moorhead. And we are the big city in the West. So something out in the western part of the state would be great. Thanks.
Senator Wiklund.
Thank you, Madam Chair. And just to reiterate what a little bit about what Senator Abler mentioned, I do hope that the new department has a new division and an assistant commissioner that oversees childcare and early childhood. And so I'm very hopeful that all of the discussion and ideas will be something that they really take in and want to help us address. I'm not trying to be a big prescriber, but I do feel like I work with them and also working with us to get, the legislation defined. So I would like to talk about the other two amendments that were posted. First, I'll move the A3 amendment. And Ms. Cunningham, these are two amendments that are addressing two specific concerns that have been kind of chronic concerns, and I'll let Ms. Cunningham testify about them. So that's
the posting.
Yes.
Okay.
Ms. Cunningham.
Thank you, Madam Chair and legislators. So I will, again, try to be brief. What Cindy Cunningham, family child care provider, public policy. This amendment modifies how things are posted on the licensing lookup. I've worked hard. I have lots of conversations with people to try to bring about generic change or process change. This is one of those that probably 7 years I've been trying to get this fixed. I was told, so this is about posting of communication and letters that are sent to programs. I do have a couple examples that I can leave so you can really see what I'm talking about. I did not want to share them electronically or even make lots of copies because I think that these documents should not be public. What they are is when there is a maltreatment, when there is a challenge, when there's a licensing action, which are the big ones, temporary immediate suspension, maltreatments, closures, fines. What happens is that there is a letter sent, certified letter sent to the program, to the provider, that in very detail states what the accusations are. It's like a court record accusation of every single thing that's being accused of it to bring about that, those temporary closures, such. What ends up happening is by the court of public opinion, it's guilty. In the center, everything's referred to as initials. For family child care, we are named, we're address, we're gone through the whole thing. But everything that DHS is accusing, which may or may not be true because it is all done prior to an appeal. So the letters are posted and they stay there until the court process or whatever is resolved, and the provider has or the program has a day in court and has the ability to have due process. And then the letters may or may not be removed because the system isn't maintained well to remove them. And so then the condemnation stays. We are not asking for hiding information. We would like a kind of a summary, short statement about what the situation is, what the accusations are, if it's again, a maltreatment or a suspension. Please make that public on the main page. But the actual letter of communication that is sent to the program is what we're asking to not be posted. I was told many years ago, because I pushed and said, why are these letters posted? And it was stated to me by a DHS employee at the time that when the LIL was made, license information lookup, a technician person said, well, we can put these on. And so the decision was made that the letters were put on. I don't think it was done in a great, let's make sure everybody has all the information. It's, again, the court of public opinion, condemnation. Parents need to know and understand what's happening. They have access and ability to get that information if there's a need to have that information. It shouldn't just be made blanketly public because it is so personal and so detailed.
So, members, Madam Chair, members, I would appreciate, if you have any feedback or input on this type of approach. This is something that I haven't had a discussion with the agency about myself, but I know Ms. Cunningham has worked on it for a number of years, so I do think it's something that we should continue to explore and have a discussion about, but I'd be open to if you have any questions or comments.
Members, questions? No questions.
Okay.
Do you want to move the amendment or?
Should we, let's move and adopt it, and then I will talk with, my commitment is to talk with the agency about it more. It may not be all feasible, and it may require modification, but if we move it today, if members agree, then we will have it as part of the bill as it sits in our committee.
Senator Wiklund moves the A3. All those in favor signify by saying aye.
Aye.
All those opposed? The A3 is adopted.
And then, members, I have the A5 amendment, and this amendment is addressing a specific concern that Ms. Cunningham can speak to. The language comes from the draft 2 standard document that came out, and it would kind of accelerate the ability to address this particular concern where family child care providers have their own children that are in the home, and there's a lack of clarity about how they can treat and take care of their own children while they're taking care of other children. And I'll let Ms. Cunningham explain further.
Ms. Cunningham.
Thank you, Madam Chair and committee members. This again has come about by a lot of work. We started discussing with DHS on some rumors that we were hearing about licensors saying that how we supervise our own children and care for our own children had shifted. And we've then found out that that had been communicated to licensors in March of last year. We didn't start the discussion until June or July of last year, just trying to find out what are we talking about. Having our own children in care is frequently why people go into this business. Love of taking care of children and moving forward. It also becomes the biggest challenge that we have because our children have to be treated as we know at this moment. Our children have to be treated as if they were a daycare child. There's no freedom, there's no flexibility, there's no parent right about how we take care of our own kids. Clock stops, then they can be in their own room. They can do things more the way they want to. In particular, as our children start getting older, that becomes a strong resentment on our children. I raised 3, started when they were under 5, and it become became quite the struggle about what they could do with their friends, that whether they could leave, go, be out in the neighborhood, and again, in their own rooms. It often becomes a rub where if a provider can't balance this, it's a strong reason why they leave, because their family can't manage the restrictions on supervision and some of the safety things. What we found out last year is that, my first communication was the commissioner at that time had made a decision based on some court cases that had been overturned in the favor of the provider. And so there would be a shift that our children would not be considered the same as a child. They would, how we disciplined them, how we worked with our own children, if it impacted couldn't impact other children in care. You have to be respectful of everyone who is in care. But it was very loosened. And so the question was, I asked for clarification on what that meant, got information, then we did a little survey with providers. They ask your licensor, what do they know? And we got very inconsistent answers. Some licensors knew nothing, some licensors knew everything. And when we went back to DHS, the question was, when are providers going to know? When are we going to know what I call the speed limit sign? When are we going to know what we can do and not do? The answer I got was that this change was complicated and that the nuances warranted that they were not going to be telling family child care providers. So if I had children in my care, if I was back a number of years, I would be sitting with not knowing what was going to work, what wasn't going to work, potentially vulnerable for maltreatment situations or condemnations about how I treat and parent. It was worded to me that this is essentially about parental rights, my ability to parent my children in my house. And again, I've been told a couple times they are not going to be telling family child care providers that this is what has been released. And then the second draft came, and it was the one gem in the whole second draft that I looked and I said, there it is. This is the wording that I was told we're not going to be told. And so what we're asking is do it now. We can get an implementation guide. It can get worked through. It can be in practice, current, so now, so providers can actually know what their licensor is going to say and do and how DHS is going to rule. The idea was that licensors would just go to DHS and ask at that time for each situation. We can't be going on in each situation thing. So we're asking to hold DHS. They wrote the second draft. They included this wording. It's what I've been told before. Let's just move it forward now instead of having to wait another year. If we wait another year, it won't be implemented until January of 27. And there's a lot of people that are trying to balance having their own children in care as they go into it and as they leave. This actually could keep some people in the business rather than step.
Members' questions? Senator Uckey.
Thank you, Madam Chair. And it's just, it's not so much a question, but a comment. I've heard after the last amendment and some of the things even now, and it would just be my suggestion, or what I'd like to see is that Senator Wiklund, you and you're working with the providers and such, that the bill be crafted the way we're hearing that we want to see it around this table and that the providers are bringing forward. Honestly, I don't care what the agency says. We're the legislative branch. They are the executive branch. We write legislation. They put it into play. If we're making them a little uncomfortable at times, I mean, having the conversations back and forth is great. But if we're pushing them or making them uncomfortable, we're doing our job, because we got to get them out of their comfort zone sometimes, because that's what makes it right. So I'm just encouraging you to let's think outside. Let's be creative. Let's do this right so that we can build the number of providers we have across the state. We are lacking tremendous numbers of slots for the needs of all of our child care. There's not a region that's not way short. And let's push the envelope some. We got to make this thing work, because for far too many years we've been going backwards. And we're tying the hands of the providers. They're throwing up their hands and giving up. We need to have that encouragement again, and we work with them. You know, we all want safety for our children and do things right, but we've gone so far overboard. I would just encourage you to fully engage with the providers so that we do what's right going forward. And the agency will come to the table and have to work with us one way or the other, and I think it'll be good in the end, so thank you.
Seeing no other questions, did you want to move the A5, Senator?
Yes, Madam Chair, I'd like to move the A5 amendment.
Motion is to move the A5. All those in favor signify by saying aye.
Aye.
All those opposed? The A5 is adopted. Senator Wiklund?
No, I think it's been a great discussion. Happy to entertain if you have any other comments or questions or suggestions, happy to work on that. But I really appreciate the discussion today.
So with that, Senate File 1232 as amended will be laid over.
Thank you.
Next up, we have 2135.
Welcome. Senator Boldon is presenting for Senator Hauschild today because he had another commitment and we had kind of a date that we needed to hear the bill. So Senator Boldon.
Thank you, Madam Chair. I wonder if we could first adopt the author's amendment to just get the bill in the shape we would like to have it heard, the A1.
Senator Boldon moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Boldon.
Thank you, Madam Chair. And I really appreciate the discussion we have had already this morning. It really is a very good lead-in to this bill. And really the discussion demonstrates exactly why we need to take this new approach. This bill has been developed in consultation with family and center providers who are doing this work every day. They want a significant shift in how licensing works, split between licensing basic health and safety versus helping providers deliver education and care. So I'm grateful to be a co-author on this bill and here to present it. It really does take a now and later approach to continuing our long journey toward a reformed child care licensing system. We know that our current approach to child care regulation and quality assurance is overly complex and burdensome, and that change is necessary. If you need a refresher, I would point you to the written testimony in your packets from over a dozen providers detailing their struggles with the current system. This bill gets at some of the more immediate challenges: interpretive guidance, standard operating procedures, and OLA recommendations related to county delegated family child care licenses. This bill also lays out a new framework for child care regulation and quality assurance that I believe offers us a chance to break out of the cycle we've been stuck in, where we tinker around the edges of our licensing mess instead of really getting to the heart of what is broken about it. So this proposal does a few things. It focuses on licensing on health and safety, as we have had some discussion about here already this morning. It relies on industry-recognized associations and accreditation for quality assurance. And it delivers what providers ask for over and over: a supportive approach, not a punitive one. I believe that we can couple what is in this bill with the work of the modernization process to get us where we need to go. And with that, Madam Chair, would turn it over to testifiers.
Sorry. Welcome to the testifier table, and Ms. Moss, please proceed.
Sure. Good morning, Madam Chair and committee members. My name is Erica Moss, and I work at Think Small. We support this bill in its entirety as a means for helping us to accomplish our goal of ensuring that all children are ready for kindergarten. My testimony today is focused on Section 2, which is that longer-term approach that Senator Boldon talked about for moving us out of the mess that we're in to a system that's truly workable for providers. Up to this point, ThinkSmall hasn't been directly involved in the child care licensing debate, so we come with a bit of an outside perspective. Here are some observations. Minnesota relies on child care licensing for a lot, and almost certainly too much. Whereas in other regulated areas, licensure is primarily about facilities. In child care, the facility license goes well beyond safeguarding children to attempt to regulate aspects of quality and also to regulate the qualifications and behaviors of the professionals involved. That doesn't make sense because licensing isn't always the best tool for the job. A couple of people have mentioned the example of counting blocks. It's important for a setting to have toys like blocks. I know one of the members here mentioned that, yes, parents are capable of seeing whether there are toys in a program. That's not something that you necessarily need to license. What's really important, though, is what the educator is doing with those toys to support the development of a child. And that's not something that you can get at simply by having a regulation about having the materials be present. The impact of all of the extra in our current system is a huge time tax on providers. This comes up over and over in conversations and the testimony you have from providers. When they're taking all of their time to comply with licensing, they're not using their time to support children's development, which is actually their job. And it's what parents pay them to do. So we have to get to a better balance. It's also the case that the current approach makes being a licensor challenging. I think one person here earlier today raised how county licensors felt about the first modernization draft. Licensors are having to fill all of these roles and be the point person for everything, and that's a lot, and it makes it difficult for them to provide the kind of technical assistance that providers are looking for. In short, we're relying on licensing for too much, and we shouldn't be surprised that we are where we are, which is why we're so excited that this bill offers an actual solution. The proposal reduces the state's scope to assuring compliance with a streamlined licensing system focused on the physical health and safety of children. It proposes using national accreditation by professional associations instead of state-specific quality standards. And it focuses on a supportive approach rather than a punitive one via teams that include expertise in licensing, program operation, and child development. In conclusion, I'd encourage members to take to heart the testimony that we've heard today. It's great to be here for this discussion and really consider what we're looking for in terms of modernizing this system. Are we going to, as Senator Boldon said, kind of tinker around the edges, or are we going to really get at the heart of what's causing the pain points for providers and address that? Thank you.
Thank you, and welcome to the committee, and please go ahead and state your name for the record and begin your testimony.
Good morning, Madam Chair and members of the committee. My name is Nate Byrne, and I am one of the directors of Summit School, which is a nonprofit child care center in Duluth. I appreciate the opportunity to testify in support of Senate File 2135. I'd also like to give a shout out to my fellow child care providers from across the state who are here behind me and more watching either live or later, because as many of you have mentioned, it's pretty hard to get to St. Paul at 10 o'clock on a Wednesday as a child care provider. I've been a director of Summit School for a little over a year, and before that I was a kindergarten teacher for 9 years. I see my core mission in both jobs as having been the same. Families trust us with their most precious thing in the entire world. They trust us to keep their kids safe, to educate their kids, and to be partners in the exciting adventure that is parenting a small human. My experience with licensing as a child care provider and as a kindergarten teacher are like night and day. Never in my kindergarten room did anyone come in to count the now famous blocks that are on the shelf. Never did someone tell me to throw out an entire play kitchen because the hook to hang the towels on it was missing. And never did someone sit in the principal's office and write them a citation for having the wrong type of form in my file. As a kindergarten teacher, I could focus on teaching. As a child care provider, as also has been mentioned, I have to focus most of my time on licensing. That's time that could be focused on providing the highest quality of care for families, and instead it's spent on paperwork that often feels arbitrary and unnecessary. Every child care provider in this room has a story about their program being cited for some ridiculous reason under the current rules. A popular one is hazardous objects were accessible to children, which gives the impression that there's sharps or open containers of toxic chemicals sitting available in every room. In reality, programs have been cited under this for a mop and a bucket in a hallway or diaper wipes that were available to a toddler on a table in a classroom. We're not talking about sharp knives, we're talking about diaper wipes. Let me be clear, childcare needs to be regulated. We appreciate the opportunity we've had for partnership and conversation with DHS and now the Department of Children, Youth, and Families on the Modernization project and their invitation to make comments, which we have done. But the issue is that the scope of licensing is just way too big. It too easily conflates health and safety with quality. For example, the citation about the mop didn't mention that it was left in the hallway so that a teacher could meet the immediate needs of a child. When parents are looking for quality, they want a teacher who will choose a child over a mop every time. To narrow the scope, we want to decouple health and safety from quality. Licensing by the state should focus only on health and safety, but that doesn't mean quality should disappear. To ensure quality, we want accreditation by approved, industry-recognized professional organizations. Quality should focus on child development and early education, not on whether the play kitchen in our dramatic play area has a towel hook. I urge you to pass Senate File 2135 to chart a new path that will make it easier to focus on what really matters, the care and education of our kids. Thank you.
Thank you very much. Just members, Cindy Cunningham was planning to testify on this bill, and I just bring to your attention, she does have a letter of support for the bill in your packet, and she goes into detail about the areas that she specifically wanted to comment on, and that had to do with more of the interpretive guidance as well as the relationship with county licensing. And so I just draw that to your attention for you to read on your own. Members, do you have questions or comments? Senator Corrigan.
Thank you, Madam Chair, and thank you, Senator Boldon. I appreciate the bill. I think it covers, it functionally describes the job that Department of Human Services should have been doing the whole time. I don't think there's a single thing in here that isn't currently a part of their responsibility, and they've had this responsibility since the invention of licensing on the daycare industry. I hope they get the message today. It's a sad state that the legislature, we should be in the last place. We should be the last ones to define the steps and the business rules and the process for what they should have been doing every day. They are the experts. We hire people to be the experts, and yet they're so detached from the process. That's why we end up here. I think we have to do the bill. I'm good with that. But the testimony and everybody here and everybody who's attended the sessions trying to get to these issues, it's the challenge we have with government on all of them. And with everything, they're so detached from it. And in this case, right, I think the 4 or 5 in the top who oversee licensing have done daycare. Yet they're completely detached from the outcomes of what happened, right? The failures of I think we went from 16,000 daycares in 2022 to some 11,000 by 2016 or 17. Now we're down to 7,000. And the need is greater than ever. And what do we hear? Nothing about how we change that. The over-regulatory burden has caused all of it. And so now the legislature has to tell them how to do their job. Unfortunately, they still won't do it if they choose not to, because people that I think don't realize, we're not the oversight. We don't get to oversee their daily operations. But at some point, we're gonna have to retrain every one of these agencies to figure out how to be attached and be accountable for the outcomes and the failures of these programs. They measure the criteria they measure their success by different criteria. And so that's what we have to do. I think we can find, we can disagree of even a lot of programs, but I want them to work. I want the agencies, I want their jobs more enriched and accountable. This is a result of all of it failing. So I agree, thank you for presenting this and bringing it forward. We shouldn't have to tell them what to do, but we're gonna if we have to. Thank you.
Senator Udke.
Thank you, Madam Chair, and I just have a comment. Thank you for drawing the difference between your kindergarten classroom and the daycare. That was just absolutely perfect, showing how absurd what we're going through in the child care side of this. And so that's all I had to say is thank you. You did a wonderful job of drawing that picture for all of us to understand what's going on.
Thank you. Any other member questions or comments? If not, I will keep us moving forward. We do have 3 more bills that we got to get through. So thank you, Senator Boldon. Do you have any a final thought? And Senate File 2135 as amended is laid over for possible inclusion. And Senator Boldon, you have the next bill that you are also presenting for Senator Hauschild, Senate File 1629. This came about, my understanding from Senator Hauschild, is a specific constituents have brought to him specific situation that they think that this would be helpful in their quest to, as parents, to find childcare. And so we wanted to bring it forward today. So Senator Boldon.
Thank you, Madam Chair. And yes, we're going to continue to talk about childcare, but in a little different way with this bill. This bill is about an unrelated individual providing childcare to two families. So the issue, as you mentioned, came to Senator Hauschild from his district because in rural communities, childcare, as we know, can be incredibly difficult to find. We can and should make common sense reforms that can improve access to care. This bill relates to the line between childcare nannies and licensed in-home family childcare providers. Currently, a nanny is not allowed to simultaneously care for two children who are from unrelated families. This activity would be classified as an in-home childcare provider currently, which comes, as we know, with significant licensing and administrative burden. But in rural communities, sometimes this sort of arrangement is the only option. And Senator Hauschild recognizes that the language in front of us will need a bit more work. It is a work in progress. I want to be clear with that, and he's open to those conversations, but we did want to start the conversation, and I know he's committed to working with stakeholders to find language that works. And with that, I would turn to testifiers.
Thank you, Senator Boldon. Ms. Cunningham was going to testify, and she had to go and open her childcare, so families had childcare. She did provide a letter that's in your packet that describes some of the concerns that she would have and her organization of licensed family childcare providers about making a change like this. I have read this and I have some similar concerns. I think it's an idea that we need to explore fully just to understand the ramifications of it. But I think it's worth discussing, and I really understand that parents, they need to find a childcare arrangement that works for them. So I'm committed to having more discussions about it. Members, do you have any questions? Oh, I'm sorry. I missed it. There is a testifier on Zoom, Nancy Deming. And I apologize, Nancy, I didn't mean to skip over you. And if you could state your name for the record and begin your testimony. And Nancy isn't unmuting herself. So, yeah, if she indicates she's available, we can take her testimony later. But yeah, thank you for joining us, Nancy. But we would appreciate your testimony in writing if you are able to provide that as well. So any final thoughts, or any other members have questions or comments? Any final thoughts?
Thank you, Madam Chair. I appreciate the opportunity to talk about this. I think it is just a conversation that we should continue to have. And again, I know Senator Hauschild is open to working on the language, but there are specific challenges in rural Minnesota related to childcare. And so I think we should be open to looking at creative solutions to be able to be sure that families have access to the care that they need for their littles. So thank you.
Thank you. So Senate File 1629 is laid over for possible inclusion. And Senator Boldon, you have Senate File 1896.
Yes, Madam Chair. Thank you. And I have an author's amendment for this bill as well. I wonder if we could adopt that first, and then I'll speak to the bill.
Senator Boldon moves the A2 amendment. Members, all those in favor, please signify. Oh, I'm sorry, Senator Edke. Is that not what we have?
Madam Chair, this is you're doing it as an author's amendment, the A2 for 1896?
Yes.
I guess that's the normal procedure, and it'd be the right to do that. But because there's such a drastic change, could we have a discussion on it first?
Senator Boldon, do you have a summary you can give us? Normally, I would just adopt it, but respecting Senator Edke's request, if you could describe.
Thank you, Madam Chair. Yeah, I can just speak to the bill, and then we can adopt the amendment. So, members, we are going to switch gears here from childcare and talk about dental care. And so, a bit of background of where this bill came from. In 2001, the legislature adopted a policy that if managed care and county-based purchasing plans failed to meet some performance standards by the coverage year 2024, then the commissioner was required to contract to a single dental administrator to administer dental services for all MA and MinnesotaCare enrollees, and that trigger is set to begin January 1st of 2026. And that single administrator is something we are, continuing to have conversations about in other aspects, and I think that is actually a positive thing. The challenge in this case is, as I said, that is currently set to take start on the 1st of January of next year, but we don't have sort of infrastructure, systems, and processes in place to make that successful. And that is the purpose of this bill, is to be sure that when that happens, and it will, we will move to a single administrator to provide that or to oversee that dental care for MA and MinnesotaCare. But we want to be sure that it is successful. We want to be sure that dental providers have the predictability and stability to be able to keep their doors open, to be able to continue to provide the care that is so needed across the state, but there's certainly special considerations in rural parts of our states. And we want to be sure that patients can continue to have access to that care. So this bill, that is the goal of this bill, to be sure that we have the processes, the thought, the systems in place to be sure that when that happens and we switch over to that single administrator, that it is successful and there's stability and sustainability within that system. So it establishes a working group of relevant stakeholders to get together and determine some of the pieces that are necessary. One, a rate structure that promotes consistency but also accounts for differences across the state, as I have said. Rural areas, metro areas, taking into consideration specialty care, those types of things. Two, an infrastructure funding strategy that invests in the medical assistance dental system through grants and loans at a level commensurate with what is obtained currently through the current managed care delivery system, foundations, and philanthropic systems. Again, we want to keep providers whole. Three, the dental service settings and activities, which should be included when calculating progress to the benchmark goal of 55%. Because we want to be sure, and that actually is the benchmark goal that triggered this to go into place. Previously, we were not meeting that 55% goal of folks in these programs getting care on a yearly basis. We want to be sure that we are getting to that goal and looking at the entirety of the care that is being delivered. And then four, goals and processes to ensure coordination of care among dental, medical, and other care providers as needed, especially in these complex cases. So if this work can be done, the working group will meet, determine these provisions here. If that can happen in this amount of time, then we can go on as planned, and we can move to the single administrator on the 1st. But if that work cannot be completed, then that just gives us more time to plan these things. It pushes the start date of that single administrator out 2 years to give more time to put these things in place. Really, this is just about making sure that this, what is going to happen, can be successful, and putting some steps in place and giving a timeline so we can be sure that it can be successful, and do have some testifiers as well, Madam Chair.
Madam Chair.
Senator Abler.
This is a really controversial amendment. I do not support it. And the authors can bring amendments and we have to vote how we vote. I will be voting no. But this came out just last night. And this program has been discussed forever. And there's hardly, the access to these, to this population is lousy. And I'm fearful if this goes forward, it's going to become worse for some of these providers. So that's my comment. Thank you.
Yeah, Senator Abler, I think, so what stands out to me in going over this more carefully is the is the fact that you've taken out the delay date on the first paragraph or subdivision 3, but you added the clause that's subject to paragraph I, which then, if I look at that, then there's a, conditional statement that says if the report isn't provided in full, then the single administrator is not able to be implemented, and then the delay is the 2 years rather than what the 4 years that were in the original bill. I think that the delay part is a part of this amendment, but it works in a different way and sort of a conditional basis on a work group getting some work done, which is quite a bit different than the original bill. So, yeah, I'm trying to balance this change with what members, who were, as Senator Udke is an author, with their understanding and processing that.
Madam Chair.
Senator Boldon.
Thank you. I appreciate that and recognize that it is different. I will say, my understanding is that, this bill would be laid over today, and I am committed to continuing to work on this language. I don't expect this will be the final language. I am working in close partnership with my counterpart in the other body, and we are very committed to continuing conversations with all stakeholders to be sure. The goal really is to be sure that this process works, that it is predictable, sustainable, that providers are kept whole and have what they need, and that patients continue to have access to care. And the concern is just flipping that switch on the first. We are not ready for that, and so offering the sort of some parameters for some work to be done to see can we get to that? Can work be done, in the next upcoming months to get us ready for that? And if it can't, then it pushes that time period out until we are ready for that.
Madam Chair. Senator Udke.
Let me go back to Senator Udke first. Senator Udke.
Thank you, Madam Chair, and thank you for letting me break in on what is normally just an author's amendment, and thank you, Senator Boldon, for engaging in this, because I am one of the co-authors on this, and this amendment to me tanks the bill for me. I really like the way the bill was in its original form, and then with this amendment, it's a non-starter. This is such a fragile market that we're working with, serving the MA group of people. Can I ask Senator Boldon, who brought this idea forward to bring this amendment at this late hour?
Senator Boldon.
Thank you, Madam Chair. I appreciate the question. As I said, I'm working in close contact with my counterpart in the other body, and it came through many conversations over time with stakeholders in all aspects of this space. And again, I'll just reiterate, we are very open to those continued conversations and continued changes to the language to make it workable and possible, with the goal really being we want this to work. We want this to be successful. We are going to move to a single administrator. That is going to happen, but we need to be sure we have things in place to be sure that it's successful for patients and for providers.
Senator Udke.
Thank you, Madam Chair. Since this came about and became public, the provider network, to me anyhow, is just blowing up, the contacts I've received and their extreme concern over it. So I'm hearing what you're saying. You're willing to, have further discussions. So if it was my recommendation, what I'd love to see is that we withdraw the amendment today. You can have those further discussions, and let's bring it back if there is some agreement down the road, but I think putting it on today is premature. So thank you.
Senator Boldon, would you consider withdrawing it for today, and then we could have the testifiers provide their testimony today, so we have that information, and then we can let members, if they have additional comments. I do have a Senator Kupec bill that we would like to get through today as well, but would you consider that?
If that is your wish, Madam Chair, that is okay.
Okay. Senator Boldon withdraws the A2 amendment. Let's have the testifiers. We have Dr. Sheila Riggs and then Dan Murphy. Dr. Riggs, please state your name for the record and begin your
Madam Chair
testimony.
and members of the committee, for the record, my name is Dr. Sheila Riggs, and I chair the Department of Primary Dental Care at the University of Minnesota School of Dentistry, and am president of the Association of Critical Access Dental Providers of Minnesota. I'll just shorten that as CAD Minnesota for the rest of my remarks. I'd like to start by thanking Senator Boldon for her commitment to oral health and her work to ensure individuals on Minnesota's public health programs have access to dental care. CAD Minnesota is a statewide association representing the roughly 300 critical access dental, or CAD, providers across Minnesota. And just for context, there's about 4,000 dentists, but only 300 of us that see Medicaid patients at the level where we get that CAD designation. The CAD providers have developed clinical models that revolve around the unique needs of the medical assistant population, whether it's serving low-income children in schools and Head Start facilities, treating individuals with disabilities and older Minnesotans in their places of residence, or staffing dental clinics with bilingual healthcare professional to serve immigrant and refugee populations. CAD providers have stepped up to fill an important role in the dental community and are uniquely suited to provide high quality of care to the patients that we see. Based on the most recent data we've seen, we CAD clinics, CAD providers provide 2/3 to 3/4 of all of the dental visits to the approximately 1.5 Minnesotans enrolled in medical assistance and MinnesotaCare. So today, I am here to share my concerns with the state's looming transition to the single administrative payment model for dental services and emphasize the need for legislation like Senator Boldon's that would mitigate damage done to the dental safety network if legislation failed this session, because that January 1 is looming so quickly. So as Senator Boldon stated, in 2021, the legislature passed a series of payment reforms and rate increases for the dental services. The legislature also established an access benchmark of 55% for all managed care companies and county-based purchasing organizations, and directed DHS to contract with that single administrator beginning just nine months from now, January 1, if that benchmark was not obtained. And it is seeming like that benchmark has not been obtained. We haven't seen the latest data, but so as the law stands today, the transition to a single claims administrator poses an existential threat to the viability of, again, the small number of us CAD providers, but more importantly to the Minnesotans who rely on them and us for their oral health care. If the legislature were to do nothing this session, CAD providers would see a significant decrease in our MA reimbursement, as the current law, as written, would require the single administrator to pay the MA fee-for-service rate. This would result in a rate cut of between 4% and 44%, a cut of that severe level, depending on the clinic and payer and code, as most managed care companies and the county-based purchasing organizations pay more than the fee-for-service rate. So in addition to the lost reimbursement, current law significantly undermines our ability to make investments in clinical infrastructure, workforce development, service delivery, and because of the gap between MHCP reimbursement and the cost of providing care, CAD providers have relied on grants from foundations, and particularly foundations associated with managed care companies, to secure essential resources for our clinic. These dollars are used to support clinic updates, expansions, equipment acquisition, workforce recruitment and training. A transition to single administrator will result in less of all these resources, as the MCOs and county-based purchasers would no longer have an interest in ensuring access to dental care for their enrollees. This would put a further financial strain on the CAD providers. So lastly, CAD Minnesota has significant concerns that the single administrative model in current law fails to account for and protect the delivery models that CAD providers rely on to serve our patients and appropriately support the integration of the medical dental care that is so necessary for complex patient care. For example, CAD Minnesota is concerned about any administrative model that might limit the use of hub and spoke mobile service delivery, as many of our colleagues in CAD Minnesota rely on that to serve individuals with disability, older Minnesotans, or children. Additionally, we're concerned that too often oral health is segregated from physical health and deprioritizes in systems that fail to account for the impact that access to dental care has on things like the management of chronic diseases such as diabetes. So all this is to say we very much appreciate the work and the thought you're putting into how to get the state ready for this. As we continue working on this issue, we're very concerned about the timeline of the transition of this magnitude, particularly in light of the uncertainty of Medicaid at the federal level also. So we just want to see all of us working together and being in discussion about what the dental payment model can look like. So thank you.
Thank you. And Mr. Murphy, if you can really keep your comments brief, we're running over time and we have another bill we got to get to. So thank you.
Yes, Chair Wiklund and members, I'll keep it brief. My name is Dan Murphy with the Minnesota Dental Association, the statewide professional organization for dentists. For years, our organization has supported the transition to a single administrator for a means to improve administrative efficiency and transparency. I'm happy to go into more detail if needed on that. But as Dr. Riggs mentioned, a concern currently under current law is that reimbursement structure would default for fee-for-service rates. With that in mind, this bill, the underlying bill, I should say, we support it with lines 2.7 and 2.8 being removed, which is that reimbursement structure. And as you've heard, there's other additional details to work out in addition to federal uncertainty regarding Medicaid. So if a delay in implementation is needed, that's reasonable and necessary. We're still digesting the A2 amendment. I would just say in the meantime, we just hope that discussions focus on all enrolled providers, not just certain populations of providers, just to ensure that the system retains all participating dentists and attract new providers. We have a mutual priority to get this right, and so thank you for hearing me today, and I'm happy to work with Senator Boldon going forward.
Thank you very much. Senator Abler.
I know we're low on time. This topic could spend a half hour at least just talking about it, but Senator Boldon, I appreciate your efforts. Just want to express my concern about part of the amendment to take it kind of internal to discussions that are out of the public eye. You've been here long enough to notice some of that. I've been here just when these things go offline and they're private, you never know what they come out with, and then it's just a really bad surprise. So please continue to work with the people that are there, and just we got to keep the access available that we have. It's only going to get worse if we mess this up. And so, Madam Chair, just to have a request, when we mark up when the delete all comes, if it's going to be in, if the version we have could be in it, and an amendment to change it could be brought up separately, and not just some language that's been worked out, stuck in there. So thank you, Madam Chair.
Thank you. I'll keep that in mind. don't have any other member comments. Senator Boldon, do you have any final thoughts?
Thank you, Madam Chair. I will be brief. I appreciate this conversation. I'll reiterate my commitment to continue to work with all stakeholders and happy to have conversations with any members as well. We need to get this right. I'm committed to ensuring that we are, making sure that providers can stay whole, keep their doors open, and that patients have access. Dental care for the population we're talking about is critically important, and we share the same goal. I want this to be successful, and we'll continue that work. Thank you.
Thank you very much. And Senate File 1896 is laid over for possible inclusion. And last, we have Senator Kupec. Senate File 2571. And thank you to your testifier who has patiently stayed with us.
Thank you for this.
Senator Kupec.
Thank you, Madam Chair. Hopefully this will be a fast and easy one here. This is Senate File 2571. It modernizes language to the Occupational Therapy Practice Act. A key component of this language request is related to the passage last year of the Occupational Therapy Interstate Compact Licensure. Statutory modifications provided in the bill are largely conforming, and technical changes of the bill adds definitions to reflect the current OT standards and increase the number of OT board members, correct fee-related statutes, and authorizes the board to administer jurisprudence examinations.
Thank you. And we have Christina Borland. Please state your name for the record and begin your testimony.
Good morning. My name is Christina Borland. I am the Executive Director for the Minnesota Board of Occupational Therapy Practice. And as Senator Kupec stated, this is very much a cleanup bill. It is related to the transition of the Board of Occupational Therapy Practice from the Department of Health in 2018. So we brought forward in the past some small changes, and this was the opportunity for our board to really work through our Practice Act, update it and make it more current with current language, current expectations for the practice. So Senator Kupec highlighted several of the provisions of the bill. I'm happy to highlight others, or I'm happy to stand for questions.
Thank you very much. Members, do you have any questions about the bill? No? Seeing no questions, Senator Kupec, any other final thoughts?
No, Madam Chair.
Okay. Thank you for bringing this forward. I know these are very necessary, and the boards need them to do their work properly. So thank you for your attention to the details needed to make sure we implement the compacts well. So Senate File 2571 will be laid over for possible inclusion.
Thank you.
And we are at the end of our agenda, and we are adjourned.